What is EMPAVELI, pegcetacoplan? EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. Adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce levels of protein in the urine, proteinuria. Important safety information. What is the most important information I should know about EMPAVELI? EMPAVELI is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. EMPAVELI increases your chance of getting serious infections caused by encapsulated bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI. Being diagnosed with a rare disease was difficult to process. At first, I had a lot of thoughts racing through my mind, but I was grateful to hear that treatment options were available. My healthcare provider and I decided EMPAVELI was the right option for me. It can be self-administered when and where you feel most comfortable using the EMPAVELI injector. The EMPAVELI injector is a compact on-body device. You place it on your stomach, and it stays there while giving you your medicine subcutaneously, meaning just under the skin. The device is removed and discarded in a sharps container when your injection is complete. My healthcare provider showed me how to administer EMPAVELI the first time. I also received one-on-one training and support from my Apellis Care Educator, or ACE, as part of the Apellis Assist Patient Support Program. Today, I'm going to walk you through the process for self-administering EMPAVELI. First, I'll discuss the steps for preparing your EMPAVELI for injection. Then, we'll walk through the steps for self-administering using the EMPAVELI injector. Before I get started, please note that you will be trained on how to take EMPAVELI before you self-administer for the first time. Also, be sure to take some time to review the instructions for use that came with your EMPAVELI injector. If you have questions, concerns, or are in need of assistance, please call the Apellis Assist team at 1-866-MY-APL-ASSIST. Ready to get started? Let's go. It's time for step 1, preparing for the injection. Find a well-lit, flat work surface area, like a table, to prepare your injection. Remove a single carton of EMPAVELI from the refrigerator. Keep the vial in the carton at room temperature between 68 to 77 degrees Fahrenheit or 20 to 25 degrees Celsius and allow it to warm up for about 30 minutes. Do not try to speed up the warming process in any way. Wash your hands well with soap and water and dry them. Then, gather your supplies. Here's what you'll need: alcohol wipes, a vial of EMPAVELI, a needleless transfer device, vial adapter, a sterile 20 milliliter syringe, a sharps container, your EMPAVELI injector. Now for step 2. Check the vial and liquid. Once the vial has been warmed to room temperature, remove it from the carton and carefully look at the liquid inside. EMPAVELI is a liquid that should be clear, colorless, or slightly yellowish. Do not use if the liquid looks cloudy, contains particles, or is dark yellow. The protective flip cap is missing from the top of the vial or is damaged. The expiration date on the label has passed. Contact the Apellis Assist team to report any issues with your vial. Next, remove the protective flip cap from the top of the vial to show the exposed middle part of the gray rubber stopper of the vial. Throw away the cap. Clean the stopper on top of the vial with a new alcohol wipe and allow to dry for at least 30 seconds. Do not touch the exposed gray rubber stopper after wiping. Step 3. Prepare and fill the syringe with EMPAVELI using a needleless transfer device, such as a vial adapter. Your needleless transfer device will come with instructions for use from the device's manufacturer. Always follow those instructions, since your needleless transfer device may differ from the one shown in this video. Some important things to know. Do not remove the needleless transfer device from the blister package. Do not touch the spike or the inside of the needleless transfer device. Do not use the needleless transfer device if it comes out or is dropped out of the package. Do not use the needleless transfer device if the package is opened. Okay, let's remove the cover of the needleless transfer device package. Place the vial on a clean, flat surface and hold the vial by the base with one hand. Using the outside of the blister package to firmly hold the needleless transfer device, push the needleless transfer device straight down onto the vial top until it snaps securely into place. Remove the blister package from the needleless transfer device and throw the blister package away. Do not touch the connector at the top of the transfer device, as this can result in contamination. Remove the syringe from its packaging. Do not touch the tip of the syringe. Attach the syringe to the needleless transfer device by twisting the tip of the syringe to the right, clockwise, onto the top of the needleless transfer device. Turn the vial upside down and slowly pull the syringe plunger down to about the 5 milliliter mark to partially fill the syringe. At this point, remove air from the syringe by gently pushing on the plunger. Double-check your prescribed dose. Your first dose, second dose, and maintenance dose may be different. Once the air bubbles are removed, slowly pull the syringe plunger down to withdraw your prescribed dose of EMPAVELI to the correct milliliter mark of medicine that matches the dose your healthcare provider prescribed. Your dose may be different than the example shown. Double-check that you have withdrawn your prescribed dose. Your dose cannot be changed after it is filled in the EMPAVELI injector. Turn the vial and filled syringe upright. Place the bottom of the vial on a flat surface and remove the filled syringe from the needleless transfer device. You'll do this by holding the vial and twisting the syringe to the left, counterclockwise. Make sure you are also holding the needleless transfer device. If not held, the syringe can't be rotated to remove it from the device. Set the syringe down on your clean, flat surface to prepare the EMPAVELI injector. The syringe will not leak when set down. Do not touch the tip of the filled syringe. Throw away the vial with the needleless transfer device attached and any remaining EMPAVELI solution in your regular household trash. We have completed all of the steps for preparing your EMPAVELI for injection. Now it's time to move on to the self-administration process with the EMPAVELI injector. Step 4. Fill the injector with EMPAVELI liquid. Peel back the cover and remove the clear packaging insert. Take out the EMPAVELI injector and surrounding filling base from the packaging and place it on your clean, flat surface. Pick up the syringe filled with EMPAVELI and twist the tip into the fill port using a clockwise motion until it is tight. Firmly push the syringe plunger down using the palm of your hand. You may have to push down fairly hard to fill the injector. Use your other hand to maintain a steady grip on the area where the syringe connects with the filling port. Notice the fill gauge moving as EMPAVELI is pushed into the injector. Make sure the syringe is empty. If not, press firmly down on the syringe plunger again if needed. Do not remove the syringe from the filling base. After the EMPAVELI injector is filled, continue with the preparation and injection. Also, do not store the EMPAVELI injector once it is filled. Step 5. Attach EMPAVELI injector to the stomach. The EMPAVELI injector should be used on the stomach area only. Determine where you'd like to place the injector on your stomach. Here are some important things you'll need to consider when choosing the injection site. It must be 1 inch from the edge of your belly button and the edge of the EMPAVELI injector, and 1 inch away from your last injection site. Avoid an injection site that is tender, bruised, red, hard, irritated, scarred, tattooed, or has stretch marks. Do not apply the EMPAVELI injector along the belt line or on areas where the injector will be affected by folds in the skin. Wear loose clothes so that they do not get in the way of the EMPAVELI injector. Clean the injection site with an alcohol wipe and allow it to dry for at least 30 seconds. Do not let your clothes touch the clean injection site. Now, hold the gray pull tab and pull. Allow both the gray and clear pull tabs to fall to the side. The tabs may fall to the side or come off completely. Do not remove the red safety tab until the EMPAVELI injector is attached to the body. Notice the two open areas on the sides of the filling base. Place your thumb on the open thumb notch, your index or middle finger on the other open area, and hold the sides of the EMPAVELI injector. Then, pull it straight up to remove it from the filling base. Do not touch the adhesive on the bottom of the EMPAVELI injector or fold the adhesive onto itself. The white adhesive will stay attached to the EMPAVELI injector and the clear liner will stay attached to the filling base. Do not remove the red safety tab until after the EMPAVELI injector is attached to your body. Make sure that the site injection has been cleaned before attaching EMPAVELI injector. Position the EMPAVELI injector so the fill window is pointed up toward your face. Press firmly on the clear portion of the EMPAVELI injector to attach it to the stomach. Do not use anything to hold the EMPAVELI injector in place. Now it's time for step 6, starting the injection. Hold the EMPAVELI injector with one hand. Use the other hand to pull the red safety tab off. The button cannot be pressed to start the injection until the red safety tab is removed. After placing the EMPAVELI injector on your stomach, immediately press the button firmly until it stays in place to start the injection. Pushing the button will insert the needle into your skin, so you may feel the needle go into your skin. Once started, light daily activities can be done during the injection. I usually schedule my EMPAVELI injections around dinner time and like to cook as I'm receiving my medication. Be careful not to bump or knock the EMPAVELI injector or button during injection. During the injection, keep your stomach totally dry. Avoid intense physical activity. Do not sleep or bathe during injection. The injection will continue as long as the button is in, about 30 to 60 minutes. To track the progress of your injection, you can watch the fill gauge move across the fill window toward empty. Do not remove the EMPAVELI injector until the button pops out. If the button does not pop out after 2 hours or 120 minutes, refer to the questions and answers section of the instructions for use. If for some reason you need to pause the injection, holding down the button will stop the flow of medicine. The injection will begin again when the button is released. If you have an allergic reaction to the adhesive, call your healthcare provider right away. Once the button pops out, it means the injection is done. As the button pops out, the needle pulls out of the skin and immediately locks back inside the EMPAVELI injector. The button popping out is the only way to know if the injection is complete. Do not remove the EMPAVELI injector until the button pops out. Step 7, the final step. Remove and properly dispose of the EMPAVELI injector. The EMPAVELI injector is for single use only, meaning you dispose of it after each injection. Use your thumb to lift the adhesive tab. Hold the adhesive tab against the EMPAVELI injector while you slowly peel the EMPAVELI injector away from your skin. Put your used EMPAVELI injector in an FDA-cleared sharps disposal container right away after use. Do not throw away the EMPAVELI injector in the household trash. However, you may throw away the filling base with the syringe still attached, used alcohol wipes, and packaging in your household trash. There may be state or local laws about how you should throw away any used needles. For more information about safe sharps disposal in your state, visit www.fda.gov/safe sharps disposal. Do not recycle your used sharps disposal container. EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH, adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce protein in the urine, proteinuria. EMPAVELI may lower the ability of your immune system to fight infections. It increases your chance of getting serious infections caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI. If you have not completed your vaccines and your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. You should also receive antibiotics to take for as long as your healthcare provider tells you. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines do not prevent all infections caused by encapsulated bacteria. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever, with or without shivers or the chills. Fever with chest pain and cough. Fever with high heart rate. Headache and a fever. Confusion. Clammy skin, fever and a rash, fever with breathlessness or fast breathing, headache with nausea or vomiting, headache with a stiff neck or stiff back, body aches with flu-like symptoms, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. Your risk of serious infections may continue for several weeks after your last dose of EMPAVELI. It is important to show this card to any healthcare provider who treats you to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated against serious infections caused by encapsulated bacteria, and that you receive antibiotics if you need to start EMPAVELI right away, and you are not up to date on your vaccines. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have a serious infection caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B when you are starting EMPAVELI treatment. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you have PNH and you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion and can be life-threatening. Stop your EMPAVELI infusion and get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, wheezing, swelling of your face, tongue, or throat, feel dizzy or faint or pass out, fast heart rate, nausea or vomiting, feel confused or anxious, skin reactions including rash, hives, and itching. The most common side effects in adults with PNH treated with EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. The most common side effects in adults and children 12 years of age and older with C3G or primary IC-MPGN treated with EMPAVELI are injection site reactions, fever, common cold, flu, cough, and nausea. These are not all the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. Please see important safety information, including boxed warning regarding risk of serious infections and the accompanying full prescribing information and medication guide. We're done! We've completed all the steps for self-administering EMPAVELI with the EMPAVELI injector. Remember, your ACE is always there for you, with self-administration training, answers to your questions, and ongoing support every step of the way. If you have any questions, please call the Apellis Assist team at 1-866-692-7527. For questions or concerns about treatment, talk to your healthcare provider.